there are two main things that can trigger melasma or make it worse. One is hormones, which is why you see it much more common in women, and it can be thicker and it can leak into the lower tissue like the dermis. That will allow your melasma to come back and come back full force. So remember, the scariest but very effective way of treating melasma is laser. So before you get scared, remember that any heat delivered to skin has the chance of increasing the risk or increasing flaring melasma. So hi everyone, today we're going to talk about melasma, the dreaded skin condition where you have such bad pigmentation that it doesn't really work to use traditional ways to improve it. I'm from Tripathy, I'm a facial plastic surgeon. I practice in the San Francisco Bay Area in California. So I want to talk to you about something that a lot of patients have that they don't know they have, they've been told there's no treatment for it, or they're just frustrated with the treatments that they've had done, and that is melasma. Let's talk a little bit about what melasma is. You might know what it is, but you may not know how bad it is. So melasma is a condition where the skin has overproduction of pigment, and that pigment has stained your skin. And three very important parts about melasma is that it is very heat sensitive, it's inflammatory, and it has a particular distribution and look to it. So the melasma has patches. So you have patches on the forehead, the cheeks, and the upper lip. Those are the classic areas where melasma has. And the thing about melasma is that it's patchy. So you have it in those areas, but it looks almost like little geographic patches on the skin. It's not just run-of-the-mill hyperpigmentation. The big part of this patchiness is that there's an inflammatory component. Your skin has some inflammation, so a lot of the treatments that treat melasma also have some treatment in there to deal with inflammation. The thing that patients also don't realize is that there are two main things that can trigger melasma or make it worse. One is hormones, which is why you see it much more common in women. So during pregnancy and menopause or hormone replacement therapy, these conditions get worse. And the second is that it is very heat sensitive. So you could be wearing all the sunscreen you want, wearing a hat, but you go to Hawaii, you get a little heat exposure without cooling your skin down, and your melasma will get worse. Some pigment can also get worse. I know that my skin always gets worse in hotter climates despite wearing sunscreen. But that's not the same as melasma. So the thing about melasma is that because it is different, it has a different distribution, and it can be thicker and it can leak into the lower tissue like the dermis. Melasma is different in terms of its treatment. It's much more common in patients of color, and the treatments revolve around dampening melasma, not curing it. There's no real cure for it, but we can make a huge dent in it with treatments or with skincare. That leads me into the three main things that work for melasma. So look, if you can't afford or it's not in your lifestyle to go in for in-office treatments, you can get a very, very nice change with at-home melasma treatments with skincare. The basis of your skincare will be protecting it from the sun, exfoliating your skin so it's turning over, getting the dead skin off, so the dark skin off, and preventing pigment from even starting. So the main treatments and the main products are going to be prescriptions. So prescriptions. You're going to be using something called tretinoin, which is a vitamin A derivative, or tazarotene. You're going to be using something hydroquinone, even like 1 to 2 times a day, up from 4% strength, all the way up to 12 or 16, depending on how bad it is. You also are going to be using something like glycolic acid 1 to maybe 3 times a week, depending on what your doctor thinks. And then you may also be taking a prescription oral medication like tranexamic acid. Tranexamic acid is a blood clotting medication for patients that bleed, but it also has great evidence orally for melasma. So this is a really nice comprehensive way, and of course sunscreen, don't forget your sunscreen, that's your best friend. But this is a comprehensive way to treat melasma at home under the care of a physician. The thing that I've seen go wrong with this treatment is when patients abruptly stop hydroquinone. That will allow your melasma to come back and come back full force. So remember, if you use a service like Muesli, or you use a service where they're giving you the hydroquinone through the mail, you need to make sure that you're tapering off properly and tapering off with another hydroquinone based or non-hydroquinone skin brightener. So something like Skin Better's Even Tone, or another type of brightening agent. You got to taper off with that. So that's a big issue with using these online companies. They're phenomenal, but you do need some guidance. The second set of treatments that I think work really well for patients that may not want a ton of downtime and want to save some money are chemical peels. So chemical peels, if they're formulated properly, are infused with things like hydroquinone and retin-A and other skin brighteners. But the benefit is that you're going in with a very strong acid. So you're doing a controlled chemical burn of the skin, you're suppressing pigmentation, you're turning it over very quickly, you're infusing it with vitamin C, and then you're also going to use sunscreen. So you're getting everything just in a shorter duration of time. And then as the skin comes off, the skin looks brighter. The downside is you need multiple treatments. The way I've designed my melasma treatment protocols is that I start off with a more gentle peel and we work our way up in using customized chemical peels that are specific to the patient and their concerns. So we can go to 25% TCA, 30% TCA, and so on and so forth. And there are also chemical peels that are designed to put on certain types of the product every single day for 3 months. Those also have a great way of managing melasma, so it's just easier for you to take care of in the future. The third and scariest but very effective way of treating melasma is laser. So before you get scared, remember that any heat delivered to skin has the chance of increasing the risk or increasing flaring melasma. So if you didn't know you had melasma in the first place, could you find out that you had one from a laser? Sure. Could your melasma get worse with a laser? Absolutely. But there are lasers that have been shown to safely improve melasma. It just depends on your skin and how you tolerate it. So one great one is Moxie. Moxie is a laser by Cyton. It is phenomenal for melasma. We've had great results with it. But sure, if you do one treatment and forget to do your subsequent ones, if you have a lot of heat exposure, or if whoever's doing it isn't using the right settings, absolutely, it could make your melasma worse. There are some other lasers that are off-label, like Clear and Brilliant and Fraxel. They have been shown to have improvements with melasma, but if you look at actually the indications, melasma is contraindicated for those lasers, meaning that they don't recommend the use of those lasers, but I will say they do have good results as well. The other one is BBL, bright light therapy. So most people would say don't use it for melasma, but there are some settings on it that may be beneficial for melasma. The nice thing about that one is you can do a test spot to see if it makes it worse. So what you've learned about melasma is that it's not like regular hyperpigmentation. It's very heat and hormone sensitive, and there are some phenomenal treatments that you can do to make it work. The key thing here is that the treatment should be dependent on your lifestyle, but also how bad the condition is. Remember, this is a medical condition, so it does require a comprehensive treatment plan. It requires a physician or someone trained to treat it because it could make it worse, and you definitely don't want to deal with something like that. If you like this type of content, like, subscribe, follow for more, and I'll see you guys next time.